Hi, I'm Bob Comator from the law firm of Levy, Phillips in Königsberg, and we're very pleased to have with us today Dr. Harvey Pass, the Chief of Thoracic Surgery at NYU Medical Center and a specialist in mesothelioma and lung cancer. Can you tell us about any exciting research or developments on the horizon that you see happening?
Yeah, within the next year, I think that there's going to be a marker that's published that is one of the best markers that's out there. I think that needs validation, but it's a novel finding. I also think that other laboratories are working on looking at every mutation in the genome of mesothelioma. I think that's a very important exercise because by doing that, just like we're doing in lung cancer and in other tumors sponsored by the National Cancer Institute, if you find a mutation that is novel to mesothelioma, or if you find a mutation in mesothelioma that, say, is in lung cancer, but there's a drug in lung cancer, then you should use it in mesothelioma, as crazy as that sounds. So then you can get these profiles of individual mutations, and if you have drugs that target those mutations, or you could start developing drugs to target the mutation, within 2 years, then you can define on a personal basis, this patient needs to get this, the studies are launched to be able to see whether you respond. I think that's one of the most exciting aspects of mesothelioma research for therapy. I also think that there are a lot of other novel things that are being done. I mean, we never thought that animals mean that much with mesothelioma. There are a number of great animal models that are being used to study the disease, but animals are also being used on a personal basis by certain institutions where if somebody gets operated on, the tumor could actually be implanted into animals. If the patient has early-ish disease, then if that tumor graft then proliferates and you're able to expand it into a number of different animals, then at the end of the day, in 3 or 4 months, you have a lot of animals. You could try different cocktails of treatments to see whether actually the animals do respond to a good one. So we know about mesothelioma. We know we have to be worried about it coming back. There are patients that then could go back to see how the animals responded, and you could use those drugs when they recur. That's way out there.
Yeah, that's
ideas that
amazing.
some people are doing that we'll see whether it actually pans out, but it's not for everybody. So I think there are I think there are more than a couple of exciting developments. The key thing is we can't be redundant. We have to work together, and we have to then validate everything that we find.